Hello everyone, I am Manar Alhamood. I'm going to present extraoral examination for 12 years old male patient referred by his dental practitioner to orthodontic clinic. In frontal examination, square to taper face with brachycephalic type of face. Facial symmetry, patient has slightly asymmetrical face because tip of the nose shifted to the left while the chin to the right. To compare that, we do composite photo, composite to the right and left side. In transfer fifth, patient shows mouth occupies space slightly narrower than interpupillary distance, nose and chin not center in center fifth. At frontal examination at smile, patient shows 95% of his incisor with intradental papillae, smile arc follow inner curvature of lower lip, maxillary midline slightly shifted to the right, mandibular midline not visible. Profile analysis to measure angle of facial convexity, we draw a line from glabella to subnasal, subnasal to begonian, and here angle is 14, which is within normal. Facial proportion for this patient within normal. Upper lip is 1/3 total lower third of face. Nasolabial angle, we draw a line tangent to upper lip and tangent to clamella. Here is 86, which is acute. Maxillomandibular prognathism, we draw a line from subnasal to vertical line and measure it from begonian to vertical line. Here begonian is 5 mm, which means above the normal mean retrognathic mandible. Nasophacial angle, nasal projection of this patient 32 degree within normal. Nasomental angle, which is angle formed between radix and E-line, here is 130. Mentocervical angle, angle formed between E-line and tangent of submental area, which here is 190 within normal. Submental neck angle for this patient is 120 below the average, which means because patient is still growing. Lip position, E-line, draw the E-line from begonian to pronasal. The upper lip is 2 mm behind, lower lip 1 mm behind, which means upper and lower lip is protrusive. In Bristol line drawn from begonian to subnasal, in this case is normal, upper and lower lip. S-line, line also drawing from begonian to curvature between subnasal and pronasal. Here upper lip is slightly anterior to this line, so it's permanent, while lower lip is normal. Z angle, here for this case is 64, which is below the average, which is below the average. Interlabial gap is distance between upper and lower lip. For this patient has 4 mm distance, which is normal. In intraoral examination, patient shows deep bite, increase over jet, and angle class 2 malocclusion. Problem list. In skeletal, we see retrognathic mandible, facial asymmetry. In dental, increase over jet, class 2 molar canine, increase over bite, upper midline shifted to the right. In soft tissue, protrusive upper lip and lower lip, nasolabial angle acute, incompetent lip.